Gummy smile is a really common complaint for patients. Sometimes people come and tell me, I want to reduce the gummy smile, what can you do? And really to address gummy smile, we need to know what's caused the gumminess in the first place. So if we look at this patient here, she said, I want my teeth to remain pretty much the same. I don't want to change my teeth too much. I want to improve the asymmetry and the width at the side. And I want to improve the midline, which isn't quite in the right place. But I also want to reduce the gummy smile. Now, in this case, we have a gummy smile because we have a lip that's super high and we have overgrowth of the upper jaw. So this is where I'm looking outside of the dental situation, and I'm looking at facial aesthetics. So in this case, I brought in our facial aesthetics doctor, Dr. Natalie, and asked her to bring this gum down before we did anything else by actually bringing the lip down. And that's called Gummy Smile Botox. And this is a really good way of previewing where the lip is going to go, because it is a temporary thing. We put a couple of Botox injections in the right place, and that helps the muscle when smiling to not lift so much the lip, but general talking and using of the mouth will be unchanged, which is why it's such a good treatment. So once we did that, we're able to bring the gum line to the lip line to something like that, and that's going to show a lot less gum. And that's before we start anything else, because my smile design will be dependent on what the mouth shape is. The other reason why we can use Gummy Smile Botox is actually we can hide sometimes gaps that people have between the teeth without needing a lot of dentistry. And we can improve the shape of the mouth. So if someone has what we call like an ellipse mouth shape like that, you can actually bring the gum down and you can improve that mouth shape as well. So quite a few reasons why it's a great option. But this has to be combined with some dentistry in some cases. So over here, what we had was a gummy smile that we corrected, but it still had a natural kind of incline like this. So now I would use some crown lengthening or laser work to lift these gum lines to actually try and create deliberate asymmetry, but that would make it look in the end symmetrical. So again, get the patient into temporaries, move on to the final teeth, and this is the final result. And what we'll see here is that the gum is much less visible. We have almost an equal amount of display on one side to another, and the lip looks as though it's perfectly straight. In fact, it's not. It's at an angle, but what's making it look straight is how we've lifted the gum on this side and we're working with the shape of the mouth. And this was 8 veneers, added minimally to the teeth. There's no preparation underneath any of these, a little bit at the front to bring that midline straight. But other than that, really, really minimal result. We could remove these veneers and the patient's teeth would be exactly like they were underneath. A natural result too. So multidisciplinary stuff. We're trying to think outside the box a little bit on this one.